All right, so I wanted to talk about the limitations on food and diet during the healing process while you're waiting for the implants to heal. And so, because a lot of patients will ask, what does my diet consist of? What can I eat? What can I chew? Just like what do the logistics look like during that process? And obviously, a lot of it really depends on the situation because there are certain people where what they're currently going through right now is probably worse than, in terms of limitations of food, is worse than what they're going to have to deal with once implants are placed and they get their set of teeth that while they're healing, while the implants are healing. So I just wanted to talk a little bit about that process and just what the logistics look like. So typically how it will work, the patient will come in for surgery, we extract all the teeth, or if patient doesn't have any teeth, we'll place the implants. And then after that, the next day, they'll come back in and we give them a set of permanent teeth that are made of, it's a nano-ceramic material. It's FDA approved as a final set of teeth. That's not the set of zirconia teeth that they will get once the implants have fully healed, but they will have this set of the nano-ceramic FDA approved final permanent teeth that they'll heal in during those 3 to 4 months while the implants are healing. And during that time, we tell patients that they need to stick to a soft food diet. So there are some companies that are advertising that other implant centers are you're limited to a liquid diet, which just isn't true. At least in our situation or our case, patients are able to eat soft foods. And what I will say is there's a lot of companies that are marketing like getting zirconia teeth the next day or like immediately after surgery, that kind of stuff, which zirconia is the best. It's the strongest material that you can get in dentistry. And the one thing that I wanted to talk about in this video is that no matter the teeth that you get after surgery could be made from the metal of Captain America's shield. Like it could be the strongest thing that ever exists in the world, and no matter what, you're still going to be limited to soft foods. And the reason why is because when the implants are placed in the bone, the implants need to integrate within the bone, and so that's what you're waiting to heal. And so again, the material of the teeth is not as important in terms of like what limits the diet compared to just the implants just strictly healing within the bone. And so anyways, that's one thing that I would be kind of wary of in terms of like marketing, is just understanding or knowing that no matter what, you're going to be limited. The good thing about soft food diets is I think that people just think liquid foods. And what we try to do is give patients a list of soft foods that they can eat. Typically the rule of thumb that we give patients is that if you can cut it with a plastic fork, then you can eat it. And so, for a lot of people that can be scrambled eggs and obviously like the typical like mashed potatoes and yogurt and all that kind of stuff. But I think overall, patients can get really creative with the food that they're eating. And in some cases, it's better than what they're able to eat beforehand, just depending on their situation with their teeth. And then what will typically happen is after those 3 months, once the implants have fully integrated inside or within the bone and the implants have attached, then at that point we would swap out, give you the zirconia set of teeth, which is your final set of teeth. And with those, that's where you can eat, apples, corn on the cob, steak, all that kind of stuff. So that's typically what the process looks like as far as eating and surgery and the timeline there.